We have a plan to reopen and live with the virus, and we knew all along, and we've said so before, that once we reopen and resume activities, we will experience a new wave of infection. All countries that open up have had to deal with such waves. For us, it is happening faster than we had expected. And it's also the first time since our opening that we are facing such a new exponential wave of infection in our community. Very soon we will reach 1,000 new cases a day, and in a few weeks' time we will probably get to 2,000 new cases a day. And that's why we have to take a more cautious approach in the current situation and make sure that we adjust quickly to this fluid and rapidly changing infection situation. The difference between now and what we had, say, a few months ago or even last year is that we have a much higher vaccination rate and so better protection from the vaccines. And that's why we've said before that our focus is not just on the daily infection numbers, but the number of serious cases needing oxygen and ICU care. And indeed, that's our key focus. Our ICU numbers are still low now, as you heard just now, but we must not be complacent and assume this will automatically remain so over the coming weeks, because severe illness typically comes 2 weeks or more after one catches the virus. So we have to monitor the situation closely and also see and learn from the experiences in other countries. There are countries that are highly vaccinated, which have gone through a wave of infection, and they have kept their hospital system intact and avoided high death toll in their society. On the other hand, there are also countries with a highly vaccinated rate experiencing a wave of infection, and despite their best preparations, they have seen these cases, infection cases, follow through to more people needing oxygen and ICUs. Their hospital systems get overwhelmed, and eventually they see more people succumbing to the disease. Take Israel as an example. It's a highly vaccinated population. It's now going through a wave of infection. Cases have gone up sharply, and the ICU cases have also risen. And over the past week, they have seen an average of 25 deaths a day. And that's why we are asking everyone to exercise restraint during this period. Scale back your non-essential social activities, get tested regularly, and let's all do our part to try and slow down the spread of the virus.